Hi dancers, happy Wednesday. Welcome back to Beyond the Point. I am very excited about today's episode. I have recorded it quite a bit ago with our guest, but I've been waiting to release it to this time because we have some extra goodies that go along with it. So let me tell you about the goodies before we jump into the interview. First off, we are doing a giveaway for anyone who reviews or shares our podcast on Instagram. And our giveaway is going to include two things. You can either win a full turnout and flexibility bundle from my online courses for dancers, which would be a great addition to a Christmas gift. If you're thinking about something unique to give to your dancer or a friend, this would be a perfect gift. It also would just be nice for you to get to work on some of that stuff that I know you're here to work on. Second, another person is going to win a $50 Visa gift card. And who doesn't want a little bit of extra spending cash right before the holidays? So you have two ways to enter. You can write me a review on iTunes. And if you do not have an iPhone, unfortunately, you will not be able to write me a review. But I made sure that there's a way for you to also enter if you don't have access to iTunes. The way you're going to enter for a second entry or as your single entry is to share this podcast on Instagram. Take a screenshot of which one you're listening to, share why you're loving the podcast, and make sure that you tag me, Align Fitness by Allie, or Beyond the Point, and share it with your Instagram friends, and you will be automatically entered to win either the bundle of online courses or a $50 Visa gift card. This is only going on for this week. Next Wednesday, it's going to be released and we're going to find out who wins. So make sure that right after this episode, you swipe down, share, and post your review. Second, our guest today came into my office this week and filmed some videos with me. So we have some great stuff on Instagram for the rest of the week that ties along with what we've been talking about today. So make sure that you're getting that bonus material by going onto my Instagram, Align Fitness by Allie, and getting those videos because you're going to love what's happening in just a few seconds. We're going to jump right into our interview. Okay, guys, welcome. Today, I'm so excited to have Dr. Courtney Wilson here with me. She's actually Skyping in all the way from Canada because she is out of town right now. Thanks for being on the show, Courtney.
Of course. I'm excited.
Yeah. So Dr. Wilson and I work together here in Southern California. I'm going to let her introduce herself, but we have had I've had the pleasure of getting to work with some of the dancers that come in and see her. And it's been such a treat for me because what she does makes my job so much easier. And I wanted her to come on and give some of her experience from being a dancer, working with dancers, and what type of injuries she's seeing, what she thinks you should be seeing someone like her for, and also maybe some tips on how to choose your practitioners and people that you involve in your dance life and your community and all that kind of stuff. So Courtney, I'm going to let you go ahead and dive in. Introduce yourself to everyone.
Sounds good. So yeah, as you said, I'm Dr. Courtney Wilson. I am a formally trained chiropractor, but I go kind of under the title of a sports and rehab practitioner. As Ali said, I'm Canadian. I was born and raised in Canada. And I really, developed a passion for movement and for dance from a young age. I danced at a competitive studio in Calgary, Alberta, Canada for my entire life. And then kind of transitioned that into being a teacher, which I absolutely love, just kind of sharing my passion for dance with the next generation. And I wanted to just further that with my career and my profession. So I pursued my Bachelor's of Science in kinesiology first. So I had a nice basis of anatomy, physiology, exercise physiology, all that good stuff. And then I went off to chiropractic school. So that's where I moved to California. I went to Palmer College of Chiropractic West, which is located in San Jose. And that school is very well known for its emphasis on sports and rehabilitation. From early on in the program, I was able to dive in and work with athletes at different events on the weekends, learning different techniques that weren't offered through school, but within the school community, from, the upper level students or the teachers, professors. And so I just, took that as my direction and then moved down to Southern California to start practice. And obviously being a dancer my whole life, you really understand what it requires of you and the stresses it puts on your body. So I felt like I had a really good basis to start working with dancers, and helping them through things that I experienced when I was dancing as well. So that's kind of where I'm at. I love working with active people. I love working with people who are motivated and really want to see changes and hold me accountable to those changes. And it makes my job really fun. So that's kind of a little bit of background about me.
Awesome. Courtney's a bomb, guys. So when you decided to go to school, did you know right away that you wanted to go into chiropractic? Why did you choose chiropractic versus maybe PT or being a physio, or just a trainer? What guided you that way in an area that there are so many ways you could have gone?
Yeah, that's a good question. So when I was in my undergrad, I actually did a lot of job shadowing. So I shadowed medical doctors, PTs, or physical therapists, they call them in Canada, physios. I shadowed I was working with trainers and all that kind of thing. And I just really found that whenever I shadowed a chiropractor, their approach to evaluating and treating the patient was very different. And that was obviously my experience in Canada. Now that I've lived and learned in the US, the DPT programs that they have in the US, some of them can be very great as well. But that was just my experience in Canada. And I was lucky enough to go to sports chiropractors specifically, and those who were trained in soft tissue techniques, and they were trained in active release, and they were trained in different things, that when I actually arrived at chiro school, a lot of my peers had never heard of those things. Mm-hmm. So I felt really lucky that was my exposure to chiropractic. I did not have the, rack 'em, crack 'em experience going into chiropractic. I didn't even really know that existed until I got into school, to be honest with you. So that was eye-opening for me. So obviously I took a very different direction with that, not only from my own practice, but from my experience as a dancer growing up and going to the sports chiropractor. So I just found that chiropractic for me allowed me to learn how to address the root cause of what was going on. And then we have so many different tools and techniques and things we can use to help heal from those injuries or fix those problems, or facilitate the patient to fix the problem, that it gave a very well-rounded approach to how I saw movement of the body and everything. So.
Yeah, interesting. So I know now that finding the right chiropractor can open so many doors to how your body heals. But I, growing up in the U.S., did have what we do refer to them sometimes as the rack 'em, crack 'em. Those of you who don't know what we're talking about, that would basically just be a chiropractor that pretty much just adjusts, and you have a very quick appointment, and they probably see a high volume of people. There's a place for that. It's not a bad thing, but where you're more of an active, you're trying to make your body align so it doesn't hurt while you're doing things, that's not always the place. And I think we'll probably dive a little more into that. But that was my experience growing up, was just a quick adjustment, and it felt good, but it never lasted very long. And when I went through my hip injury and a couple things after, I didn't seek out help with a chiropractor at first because I just had this quick in and out experience. And it wasn't until a couple years into my injury that I actually found someone like you who had all those tools that you were talking about. They had soft tissue, they had information about the nervous system, and they had all these different variations of movement assessment that I hadn't seen anywhere else. And it really, really opened my eyes to what chiropractic could be, and realized that I was missing out on so much growing up.
Yeah, I often have people come to me, dancers or not, that they're like, oh, I've done chiropractic, I've done PT, nothing works for me. And the things I've done those exercises, I've gotten those printouts before, those are a thing of the past. They didn't work for me. And, it's kind of fun convincing them and working with them and proving to them, there are things that you can do to get better.
Yeah. Well, you're great at the proof because I've been to you. That's why I have you on, because I've experienced it, and you do have this is how you felt before and this is how you feel after. Range of motion improved, pain, pinching in the hip, back pain. I think I've been to you for some neck stuff. And you actually have done very little adjusting on me. I think I could probably count on one hand how many times you've adjusted me. But movement assessment and figuring out what's actually causing the neck pain, not just maybe the symptom of the neck pain.
Absolutely.
So,
yeah. I mean, don't get me wrong. There's a time and there's a place for an adjustment for sure.
Yeah.
There's definitely instances where it makes a significant difference. But like you mentioned, we want it to stay. We want those benefits to last. And that's where the rehabilitative training and the movement training really comes in, so that your body can hold on to that benefit and you don't need to seek out care all the time.
Yeah.
Like I prefer patients to be able to manage a lot of their stuff on their own. I'll give them some tools of things to work on, things to troubleshoot. If those things don't work, then call me.
Yeah.
But I don't need you to come into my office 3 times a week until you're dead.
Yeah.
It's not my philosophy.
Thank goodness. It takes a lot of time to do that.
It does. And I mean, dancers' schedules are crazy.
Yeah. They have to squeeze them in.
Sometimes I'll squeeze people in at like a 7 a.m. or like a late mid-afternoon between school and dance. Like it's just, the schedules are challenging. So you have to make the best of it.
Oh,
and
yeah.
if you can have tools that you can use on your own, then great. You can do that. You can go down on the ground anywhere.
Yeah, absolutely. We have a shared client that we've really worked hard to find her ways to take care of her pain or discomfort. She has quite a severe injury, I would say. It's not just a pinchy hip or maybe a hamstring
strain,
but we've worked really hard to find things that she can do on her own, and she does. I would say she comes into both of us regularly, but given what she is dealing with, the fact that she can take care of her own injury at home on the weekends, and she just went on a long trip and was able to manage her symptoms, that speaks very highly of what you're giving her, that you're able to teach her how to take care of her own pain, because she now understands where the root of things are coming from. So it's not just try this plank or do this sit up. This is what we're trying to change. And that's really changed her dancing, because you've taken the time and you have the knowledge to apply it into the dance world, not just simple pains here or there.
Right. Well, I feel like you do that too. And that's why we work well together, is like you're able to look beyond just the dance class. Because for that patient, for example, one of her triggers is sitting. And as soon as she goes back to school, well, what do you have to do for most of the day is sit. So we're not going to get anywhere in the studio or in our clinic or whatever you want to call it. You're not going to get anywhere in those places if we don't address, what's triggering her throughout the day.
Yeah. Yep.
Are you constantly, one of our colleagues always says, you're picking the scab. It's like, yeah, if you keep picking off your scab, it's never going to heal properly. Same thing goes with a back pain injury, for example.
Yeah, absolutely. So talking about the injuries, what are some of the common injuries that you see come into yourself from dancers? And I'm going to piggyback on that also, because I know that some dancers, including myself when I was younger, would wait until they're in extreme pain to seek out help. So what are some of the common injuries that you see? And then what are some of the things that you wish people would come in to address before they turned into something serious?
Yeah, that's a good question. So common things that I see are, I'll just kind of start from the ground up. So usually, there's a lot of ankle sprains, or, it was a kind of an ankle sprain and then there was some weakness there and then they got a really bad ankle sprain. So ankle sprains of any severity, I see a lot of that. Low back pain for sure. Lots of low back pain. Yeah. And then as well as the hip issues, pinching in the hips, restricted hip mobility, things like that. So I'd say mostly lower extremity and lower back is most common. Of course, we also address the upper body, but we're using our upper body with less force most of the time.
Yeah.
So that I'd say those were kind of the top 3 things. I do get some knee pain. especially when people are growing. That's really common.
Yeah.
With overloading of the quads and whatnot. And then some people even come in with just growing pains and they think it's from dance, but it's, it's just a factor of life. Your bones are growing fast and your muscles are and ligaments are trying to keep up. So
yeah, we both see a lot of that genre, or not genre, but the age in life when kids are growing and they shoot up in a month 2 inches. And I know for myself and for my parents, sometimes it's hard to know, is this a growing pain? Is this an actual pain? And I mean, for me, we treat it the same. We just know that if we can make it feel better, maybe there's a structural thing that we could have that we can figure out and change. But sometimes there's just going to be some discomfort as they grow and change.
It's also important. It's also important that, like, as you're growing, that you allow your structures to grow in the best environment possible. So if you're having, say you've sprained your ankle and it went away within a week, you're like, oh, great, I'm good. But what if there's been something in the ankle that's changed or shifted or restricted in the joint, and then you sprout up 2 inches over the summer? There's going to be some repercussions to the fact that your ankle is no longer moving properly necessarily. So we want to facilitate the right environment for our patients to grow and to dance and to perform effectively. If we're able to troubleshoot that small ankle sprain, then when they shoot up 2 inches over the summer, maybe they won't have as much growing pain, because everything is able to elongate and grow and strengthen properly.
Yeah. You were saying that when you have an injury, then, it comes in and it can grow into another problem, basically, by not addressing it, even though that immediate pain went away. I see a lot of that. I see a lot of people that I'm going to use the sprained ankle analogy again. Yeah. They sprain their ankle, it gets better pretty quick, or, 6 weeks, whatever it takes, and their ankle feels fine, but what we don't see on ourselves, and maybe if we're not trained to see it, is that there's huge compensations that happen in the hip and then into the back and knee, then down the road causing that knee pain that you're seeing, the back pain, and it all spurred from having that moment of sprained ankle, misalignment, not strengthening correct with that new alignment that you have from growing or whatever it is. So when people ask me when should we be coming in to see someone like me or like you, I say after you've hurt yourself, you need to go in and get a tune-up. It's just like a car. You have to go in and make sure that everything's running properly and that the hips are working, the back is working, the knees are working after you've had some type of injury. Even just something simple as like a strained neck can cause stuff all the way down the spine that then later turns into a bigger issue.
Yeah. Well, typically when you visit any type of doctor practitioner, they're going to ask you a bunch of questions when you first get there, right? Mm-hmm. And the reason those questions are important is exactly what you're just saying, is for me to know that you had an ankle sprain 6 months ago, or maybe as a kid you had a skiing accident or something. Like, these things are important for us to know as doctors and practitioners, so that it gives us a big, an overwhelming picture of what your body's been through and what could have possibly originated or sparked these changes in your movement. Because if you're born healthy and you're born with a healthy nervous system, we develop proper movement patterns and breathing patterns and stabilization patterns naturally, right? That's how we learn to crawl, and we learn to roll, and we learn to walk and squat. These things are innately driven inside of us, right? Your parents don't yell at you to start walking. That's not how it happens. So if we have the ability to access those proper patterns, and something happens and you end up straying away from them, this is something that we can help you kind of come back to that.
Yeah, absolutely. You probably have a better way of explaining this, but when I have dancers who come in and say, well, why am I moving this way? I didn't realize that, say, I was shifting over to my left side. I thought I was in the right and the center. I always use just very simple, broad analogy of when you hurt yourself, whether you know you hurt yourself or not, it can even be just a stub toe. Your brain recognizes that and then says, don't do that again. And it moves away from the pain, and it will find a new way to move, an inch over, or it's super small. It's not even an inch.
Oh, yeah.
But then you form this new pattern that's over here to the left, and it feels normal to you until someone like you says, nope, not normal. Let's get you back into the center. And then we get you moving, and it's just back to a neutral place in life. And I think we need to come back to that often. We find ourselves off of that middle ground or that neutral place.
Yeah, our bodies are masters of adaptation, for sure. Which is such a blessing, but also can be a curse in certain instances. So yeah, you're always going to find the path of least resistance. Your body is, and you're always going to try. Your body wants to do and perform for you the way you're asking of it. So it's going to find a way to do that.
Yeah, absolutely.
And although it may be subtle, some of the shifting or the compensations may be subtle. When you're practicing the same technical move 30, 40, 50, 500 times over, your rehearsals, that adds up.
Yeah, absolutely.
It really adds up to overload and overuse injuries. So,
yeah, absolutely. So I have a question for you. Knowing that you have a very broad knowledge of movement and adjustments and different ways to work with the body, do you ever just adjust a dancer? If someone comes into you, there's never been an instance where you're like, oh, all you need is a quick adjustment.
No, I've never done that.
Yeah.
And I don't think that's appropriate. And that's we could really dive down that rabbit hole.
Yes.
But what I think is really important is what is what's the why behind the treatment that your doctor is going to be giving you. So the adjustment is an intervention that we use as chiropractors to facilitate motion and restore motion to a joint. Now, most dancers have tons of flexibility and tons of motion in most of their joints. So what I see is most of the time people are actually lacking the opposite of mobility. They're lacking stability. They need more stabilization. They need more control of their joints, and they need control of their joints in large ranges of motion, which is not a quote unquote normal thing. So yeah, there are instances, for example, I see a lot of mid backs that need adjustments. We're sitting a lot, we're on our phones, we're studying, we're sitting on an airplane, whatever it might be. That area can get very restricted. So that's an area I do adjust on frequently.
I'm going to slip in there really fast that I think that, and correct me if I'm not on board here.
Yep.
I believe that because dancers, especially ballerinas, try to tuck their pelvis so much and get under, it restricts what's happening up in the T-spine up higher. And so not only are we bending over, we're on our cell phones, they're in school, but they also then stand and are pushing their spine out of what would be maybe optimal spine position or alignment. And then we're creating the chain of stuck all the way up.
Yeah.
Can that
absolutely.
be a part of it also with that mid-back needing to be adjusted?
Yeah, absolutely. And of course, the other important factor to that is our diaphragm. Our muscle of breathing attaches to that lower middle back area. So if we don't have the proper mobility through there, it can restrict our breathing patterns. It can change our breathing patterns as well. It can change our ability to create our proper stabilization through the core. And if we don't have that, the wheels are going to start to fall off.
Yeah. We don't realize, I think, maybe just as humans, but definitely dancers do not seem to realize how important the correct movement of their diaphragm is. Probably because we hold our breath so much and we
hold our breath and suck our stomach
our stomach in. Yep. That's exactly what I was going to say.
I think we're going to need a whole podcast on that.
Well, we'll do it because that is one of my least favorite cues. And, we all did it. We all have been there. That's how we were trained. But there's so much better way to do it and get better results than pulling your belly button back towards your spine. Yeah. But
I hope that in 70 years when we're dead, or 80 years, however long you want to live, that no dancer comes into their doctor or trainer and says, well, what you're telling me is the opposite of what my dance teaches.
Well, dancers that
we
are
would
listening.
feel like it's a job well done.
Yes, absolutely.
Get that message out, because the amount of times that I'm sure you hear that and that I hear that, everything you're teaching me is so opposite what my dance teacher's telling me.
Yeah.
That's the fundamental issue that we want to change.
Yeah.
We want to change.
Yeah, it is. And that's why you're here on this podcast. That's why we're making our small efforts. So dancers that are listening, this is your goal. When you become teachers or go forward in the dance world, you're going to have a way better knowledge base than either of us had starting off. And you're going to be able to inform the future generations of healthy ways to be a dancer and keep their bodies going.
Don't be afraid to be different. Like, I've had people even who are teachers that I've talked to about this, and they still cue their dancers, suck your belly button into your spine, and they know better. Yeah. But they're just scared to be different, and it's taboo to talk about these things in the dance world. But I want us to change that. Yeah.
I think I've done it with you, Courtney, but maybe not for a little bit. I have a kind of a standard little standing assessment maybe for people. Mm-hmm. And I really talk about the DOT system. If you worked with me, you know what I'm talking about. And for me, it's a way to line up the skeleton and to get the body to support itself without pulling the belly button back to the spine. So I have people stand in their best, I say stand in your best dancing posture, and they stand up tall, they lift their chest really tall, it throws their back out of alignment, and then they pull their belly button back to their spine and they tuck their pelvis. And we look in the side mirror and I say, okay, take a mental picture. It looks good. Like, you look good. You look like a dancer.
Right.
Now let go of all of that, and we're going to do the way I want to. And I have them get into this in a very different way than they would in ballet class. And then they look over, and every single one of them, their eyes get bigger, and they say, oh my gosh, I'm standing so straight. And their spine looks long. They're not pulling their belly button back. They're not lifting their chest up and their rib cage flaring. But they say, I can't do this in class. My teacher's going to tell me to pull my belly button in. Mm-hmm. And I always say, well, do you look like you need to pull your belly button in? They say no. And so it's just a different feeling. And I say, I promise you, if you do it this way, exactly this way, your teacher will not give you that correction, because you're doing what your teacher's asking.
You're just going about it in a different way. Yeah. You're getting to that end result differently.
Yeah. What your teacher is asking is their visual knowledge. I do think dance teachers have a pretty good eye. I think that especially the good ones know what your body needs to kind of look like to work as a dancer, but their cues are just passed down from generations, or they're not quite aware of what the patterns are, the structures are that need to be in place for your body to move this way. So if you are doing it correctly, but just a different approach to it, your teachers are not going to say to you, oh, you need to pull your belly button in more. They're going to say, great job, Courtney. And you're going to say, I'm not pulling my belly button in.
And then you're going to come back to our office and tell us, guess what my teacher said?
Yes, which is what happens.
Yeah. I love the reporting back. I'm like, so how did your extension look in class today? Oh, my teacher said it looked amazing. And I'm like, yeah. And are you doing this, and this that we were talking about that was wrong? No, I'm not doing that anymore.
Mm-hmm. Yep. That's
my favorite. I'll never forget, Allie. One of my favorite cues that you taught me was when someone comes in wearing a baggy t-shirt or like a looser fitting clothing. Yeah. And you're saying, is your stomach relaxed? Is your tummy relaxed? Yeah, it's relaxed. And then you pull the t-shirt, pull the client's t-shirt.
Yeah.
And all of a sudden what happens? Their posture completely changes. They suck in, the chest comes out. They go right back into all of those dysfunctional, if you want to call them, patterns of stabilization. Yeah. And I'll never forget that. Yeah. That's awesome. I definitely stole that from you.
Oh, yeah. Well, we steal things from each other all the time. For everyone listening, what Courtney's referring to was great, and it was such a good learning moment for me. I had a client who had some pretty bad knee pain and dancer, and we'd been working so hard on her breathing patterns and her stabilization patterns, and she was doing great. We were doing pliés and grand pliés in first, and she was doing great. And I knew the moment that I pulled her t-shirt tight and she was looking in the mirror, she was going to adjust to her ballet brain and pull her belly button in, like Courtney said. And she did it, and she instantly said, my knee hurts. And I was like, well, that's because you did your ballet brain. we have to make that change. So that was a huge.
We should have got that one on video.
Oh man, there are so many moments I wish I had on video. So many ahas. Like I just need a little camera in the corner that just says, smile, you're on camera, you know.
If you haven't checked out Allie's flexibility course yet, you need to do that because some of that content is so awesome and the people's reactions are just amazing.
Yeah, they're pretty stellar. That's a coming topic. If it is like flexibility stuff.
Section where you like have all of the awe shock moments like all in a row.
Yeah, absolutely. Yeah, it's fun. It's fun to see people's reaction when the body works so well for them and they realize how easy it is.
Yes.
I think we associate hard effort constantly with the body feeling well. And there's definitely a high level of maintenance that happens for the average person. But for a dancer, you're working your body in such extreme ranges. You do have to work your body in the other ranges to keep yourself healthy and moving. But it's not.
Why don't we talk about that? Like, oh my gosh, a dancer lifting weights?
No. Yes. You can't see my face, people, but that is what we should be doing, right?
Yeah, I mean, I had never lifted a weight until I graduated high school and I became, I stopped dancing competitively.
Yeah.
There's something wrong with that picture.
There is. So, do you know what the exact number is? They say when you jump, you are putting 5 times your body weight on your joints.
I don't know the number.
It's something like that. It's shocking. Like, what? Like, the amount of force that lands on your body when you land from a jump is not just your body weight. It's 3-5 times higher. Mm-hmm. Doesn't matter what the number is.
And you're barefoot, too. And you're barefoot, basically.
Yeah, you are. No support, no nothing. And that's fine. But then we have dancers or teachers or people that say, oh, you shouldn't weight train. You don't need to put that extra weight on your body. You just need to be able to move with your natural body weight. But every single time you land, every time you're not holding the correct torso tension, the core control that people like to talk about, every time you let your body sit in your rib cage flare, you're putting extra weight on your bones, on your spine, on everything. So there's so many other reasons to be using weights as athletes and as dancers specifically, but this one right here should just blow it out of the water, guys. You have to train with weights. You have to. You have to train correctly.
Absolutely. And like, I was even just thinking of it from like a sport by sport perspective. Like it seems as though most every other high level sport, they don't just do that sport, like football, for example. And the NFL, there's only roughly 16 regular season games a year. But what do you think those athletes are doing the other 300 and whatever days?
Yep.
Like there is so much that's going on besides the actual game and besides the actual performance of the technical skills in the game. Why is that not a status quo for dance?
Yeah. I don't know why.
Our cross training, and I use the air quotes for that. Why is that just like doing crunches and leg lifts for 45 minutes in between classes? Like that's not sufficient.
Yeah, it's not
at all.
It's not. If you are listening and you haven't checked this out and haven't seen it, I will try to post it in the show notes. There's a wonderful article about the Royal Ballet and their cross-training program, and they 100% have every single dancer lifting weights, and it is so wonderful to see. They have it on their they have a video on their Instagram. Go check it out. But everything from their boys all the way to their principal ballerinas are deadlifting and squatting and lifting heavy weights. It is so nice to see, and I'm hoping that is a huge ripple effect, and their dancers are so lovely and well trained, and I've heard wonderful things about their PT and people who are in charge of their extracurricular well-being, or cross-training as we call it. I've heard really wonderful things about that, so I'm hoping that starts to trickle out into the rest of the world, seeing that these dancers are some of the most elite in the world, and they are using weights,
and they're leading by example now.
Yeah.
It's
pretty
not
amazing.
Just us preaching.
Yeah, right. So
lift weights.
Right.
Well, I think like the proof is in the pudding, really. Like you and I have seen it, and I hope that more people start to acknowledge this too, is like when you train, say in a deadlift, you're training your posterior chain, you're getting some more eccentric load and strengthening through those muscles. When you're going to perform different activity or different technical moves, that cross training is going to translate into your performance. Mm-hmm. And I think that's a misconception. Like, we're not training you to be the world's best deadlifter.
Yeah.
Like, that's obviously not your sport. We're training you to be the best dancer that you can be, and we're trying to facilitate that. Yes. And so we have curated different exercises and different things that we think are effective for your extension, for your grand plie, whatever it might be. Mm-hmm. And that's what's really going to help you to perform at your best.
Yeah. Well, and this leads right into why you need to find a trainer, chiropractor, sports medicine person in your corner that dances or did dance and understands. Because if you don't, somebody who doesn't dance can look at the sport or look at, the art and say, oh, you jump a lot. Oh, you get your legs high. Oh, you turn your legs out. And they can make educated guesses on what you would need to work on strengthening. But I can tell you from working with other doctors in the same office as me, and as I've gone out and met with other people in your field, Dr. Wilson, they are wonderful at what they do, but you add in the element of extreme range of motion, and most of them will say, I admit I don't know how to apply that correctly.
Right. So can I give you an example?
Yes, please.
So in physical medicine, we have what's called a straight leg raise test. And this test is used as a predictor of issues in the lower back, the SI joint, the nerve roots, whatever you want to determine what's going on or what the root issue is. Now, a straight leg raise means you lie on your back and the doctor raises your leg up towards the ceiling to see how far it can go, how much tension there is on the back of the leg. Is there pain? Is there numbness? Is there whatever? And so for a dancer, obviously lifting your leg up straight in front of you, the goal of that is to have it touching your head. Now, I don't think that my mom or my cousin who works in a hospital is going to be able to do that, touch their head. So when you're doing the test, you have to take the population into consideration. And perhaps that's not a good test for a dancer because they're going to have overridden that tightness and that neurological change because of the way that they train themselves. Mm-hmm. So a straight leg raise, although it's been, used for a very long time in medicine to test for different low back or nerve issues, it might not be the right thing to do for this population.
Right.
So that's you as a practitioner, you have to consider that when you're deciding your differential diagnosis. Basically, when I'm testing you and I'm figuring out what's the cause of your pain or what's the cause of your hip issue, these are things I have to take into consideration.
Yeah, absolutely. You're right. And I know from thinking back to my younger years of seeing a chiropractor and PT, all of them would say, oh, you're so flexible. Yeah. And I remember thinking.
And in your head, you're like, I'm not flexible at all. I need more flexibility.
Exactly. Yeah. It was like, no, what are you talking about? I can't put my leg on 3 blocks and sit down in my super splits. Like, I'm not flexible at all. And then there was they kind of graze over it because they go, oh, your hamstrings are fine. But what I tend to see, and this is also probably a podcast for another day, is that flexibility for dancers tends to be fine. I know we all want more range of motion. I have a splits course. I know you want more range of motion, but most of the time it comes down to how you strengthen that range of motion. And then I see the range of motion, the flexibility increases dramatically when we more accurately balance out the strength and flexibility with it.
Control the range of motion.
Yes.
Exactly.
So I am a gyrotonic instructor, and for a while that's all I did. And I love the gyrotonic method so much. I love that you do get to make that control in extreme ranges of motion, and I use it with every single client.
And you can tension it too with your pulley systems, which is really nice.
Yes, you can add a little bit of weight to it and give it a little more resistance. But I also have to say that once I started adding regular weight training into each dancer's weekly visit with me, that's when I started getting comments back, like we were saying, how they come in and say, oh my gosh, like my teacher said this was so good, my core, my this, my balance. I'm getting way more, the comments coming in are more consistent, and they're happening faster than when I was solely doing gyrotonic. So that just tells me that gyrotonic has, or I'm going to also put Pilates and yoga into this area. Yeah. Great. They do wonderful things for you, but they are not the alone key answer for your cross training. There needs to be that weighted element, the feet on the ground, the stability that does not look like dance. That's a big thing, I think, to think about. Your cross training probably shouldn't look like dancing. When I see people on Instagram and in, whatever YouTube world, and they're standing on like a Bosu ball with super turned out legs, an extended high leg to the side, and then they're kind of holding like a 5-pound weight. I'm like, that's cool. It looks really cool. And it's helping you a little bit to get your extension higher. And I know you're working on your stabilization in your ankle, but I don't think that's quite the cross training that is needed for the most part. And well,
you also want to get the most bang for your buck, right?
Yeah.
So you could practice that exercise you just described for a very long period of time, or maybe there's something you could do that would make that change for you much faster and more effectively.
Absolutely.
Yeah, because you want to maximize your time and your efficiency of what it is you're doing with training. And I would rather someone spend 5 minutes on some rehabilitative exercises and sleep for an extra 45 minutes than, bang your head against the wall and be doing a bazillion of some exercise that maybe isn't really doing much for you.
Yeah. So as you say, like rehabilitative exercise, I have a very strong feeling of what probably pops in people's minds when they think of that. And I would say that most people probably think of I'm going to use like a more sickly motion, like small and can't really do a lot and something's painful. But my experience is that when you say rehabilitative, it means you have a weakness in some area, in something that you're treating and seeing, and you're going to work to strengthen that, knowing that, again, that could help them get their extension higher. So it's not a flashy move that you're like, wow, look, I'm working on my extension being so high. You're working on how the diaphragm connects to the psoas and here and there in the spine, and that in the end gets your leg higher. So
also, we have to consider, which I think is a valid point, is sometimes you may have pain in one area, but the problem is originating from another area.
Yeah.
So like for like a knee client or patient example, you're having pain in your knee, and you and I are focusing on their hip maybe.
Yeah.
Or their foot or both.
Yeah.
And they're like, well, why haven't you done anything to my knee?
Why haven't you touched my knee?
Yeah. So that's on us to explain that to the person and to really hone in on that. But yeah, it probably isn't going to be that fancy.
Yeah.
It doesn't have to be fancy, and we don't have to reinvent the wheel, but there are some really, really fundamental things that need to be addressed, and that we've developed almost like a take home for our patients and clients, because some of the stuff is so detailed that we maybe don't want them to do it at home. But then there are other things that are so fundamental and simple that can be easily reproduced.
Yeah, absolutely.
Yeah.
So do you have any suggestions on how a dancer, their parents, can find a practitioner that's right for them? Somebody that kind of hits these marks we've been talking about. Do you have any suggestions on how to find that? What to look for?
Absolutely. So this is obviously my opinion, and this is the way I practice. So this is what I would recommend. And with that caveat being there are other things that work for people better than what I do. That's okay. But what I would recommend is signs that you're at the right place, or you're in the right office, or you're with the right doctor or practitioner, is that they're going to start with an in-depth analysis and evaluation. And something like that takes time to complete effectively and properly. So I would say, you should be evaluated and worked with for at least 45 minutes to maybe even an hour and a half, depending on the setup. Mm-hmm. I think it's also important that the treatment involves more than just you lying on their table and getting worked on. So those soft tissue techniques and the adjustments and some of the neurological work, those all have a great time and place, but that also needs to be reinforced with movement, evaluation and treatment of movement. So you want to make sure that part of your visit to the practitioner involves active care. What I mean by that is, I'm getting you to start on like a glute bridge, or we're starting, maybe you're further progressed and we're doing a deadlift. Those things are really important, like we said earlier, to reinforce the changes that we've made in the joint or the muscle or the ligament or whatever it might be. So those are two things. Another thing that's a really big red flag for me, for most injuries, and I say most because not all, but rest is not a treatment. So of course, if you've had a broken bone or a fracture, or there are certain things that require you to rest. But for the most part, from I think what both of us see is, like, despite having an injury, there's so many things that you can work on, and you can still be active, maybe just in a different way than what you were doing before. So if a doctor tells you, oh, just rest for 6 weeks and then go back to dance, that's a bit of a red flag for me, because you have to think about it from what caused this perspective. So if you have let's go back to the ankle. If you have an ankle issue and you've sprained it 3 times, and the first 2 you didn't take any time off, and then the third one was finally bad enough that you went to your doctor, so you went to your medical doctor, they did an x-ray, nothing's broken. You're like, okay, they're like, you know what, just rest for 6 weeks, ice it, put this tensor bandage on it, and it'll get better. We have to think about the 2 previous injuries and why those happened. So despite that your ankle is really hurting you and you maybe shouldn't return to dance right away, that's where you end up with working with me to get an evaluation. And then that's when I refer people to you, Allie, so that you can help them reinforce their training. Once I've kind of given the okay of, like, tissues are looking good, ligaments are healing, it's time to start progressively loading it and getting you back to your dancing level. Because you're not just getting back to walking to and from your car, you're getting back to, like you said, jumping and loading your ankle with so much extra force that it's not like an everyday person spraining their ankle. So if someone tells you to rest, I would challenge you to seek out another opinion.
And that's fantastic, because I think so many of my dancers previous to working with me, and I just say that because I hopefully have changed their mind, is that they are so scared to go to the doctor because they don't want to be told they have to take 6 weeks off.
Oh yeah. I mean, you and I have experienced that.
Oh yeah. Yeah, absolutely.
You have your performance coming up in 2 weeks for Nutcracker, and the doctor tells you to take 6 weeks off. Like, that's not an option.
Yeah.
At least not usually.
Yeah. So working with Dr. Wilson and, me working with Dr. Wilson, we've really worked hard to find what's the healthful way to find the middle ground, I would say. Mm-hmm. So we've had a couple people who have injured themselves right before they need to do something. And because we understand the physical demand and then the emotional demand, which is a huge part of it.
Very large factor.
How emotional we feel as a dancer when we've been injured, and it feels like that identity is just being ripped away from us because we do have a show in 2 weeks and you've worked your whole life for this one show. We've been able to find ways, again, the knowledge of how you build exercises to then get to an end result, where somebody who doesn't understand the sport is going to say, just take 6 weeks off. Someone who does understand, well, you could actually go to class and you can't do everything, but you could try to do some plies and you could do this. And then you need to sit and be doing all your exercises while you're watching class so you're not missing out. And that's going to get you so that you can perform. And is this going to be your best performance you've ever done? Possibly not, because you just had to take a modified 2 weeks. But we still have you moving. We still have your mindful health in our forethought for the future. But there's a way to, for most cases, there's a way to keep you very involved in the dance studio without completely taking you out. And I think that finding the right person like yourself, to someone that you can trust, to say, you know what, this is an injury when you do need to take that time off, then I really trust you when you say that, because that's not your go-to. So I like that.
Well, I think that's when we start to discuss the dancer's goals, because, you know, if you're 14 and you're just worried about the nutcracker, but you plan on being a professional dancer for the rest of your life, then we need to think about your movement longevity. We need to think about the possible repercussions of you performing in the nutcracker versus it, you know, becoming a what's the word I'm looking for? Like, when the injury is really, really like a career ending kind of injury. We don't want to allow you to get to that point. And I take a lot of responsibility in that, because I want the best for all of my patients, and I don't want to be saying yes to them. Sure, go ahead, perform, and then something worse happening. Yeah. And there was a big story of that recently in the media and basketball, right? Yeah. And where there was an Achilles that was torn, and, you know, the athlete got cleared to return, but there was questioning about whether they should have returned. And so I don't want that type of stuff to happen to people that I'm interacting with. So yes, I would take a conservative approach, but at the same time, we have to evaluate the patient's goals. And if it's a long-term goal that they're trying to reach, then maybe we're going to approach the management a little differently than if it's a short-term goal they're trying to reach. Yeah. If you're 18 and you're auditioning for a company and you're trying to go off to college the following year, you know, or in a couple of months, then, you know, we might have to battle through it a little differently. But that's where we get into using other tools that can help us. So there's a lot of things that we can evaluate on exam and evaluation, but there's some things I don't have x-ray vision. You know, I can't see through your muscles and your skin. And that's where we can use things like imaging. So that would be like an x-ray or an MRI. If we're really concerned that something could get worse, then we need to get that imaging first to find out if it's safe for you to continue performing at whatever level it is you're needing to do. Yeah. So we're really lucky, you know, living in America, that we have the accessibility to that. Like, you can go and get an MRI this afternoon if you wanted to. So Allie and I have used that in a certain couple instances where it was a short timeline for an athlete or a dancer, and we had to know, is it safe? Because I can't imagine, you know, something worse happening and it being my fault for saying yes. Yep. Go ahead. Yeah. You know? Yeah. Yeah.
Well, great. So I kind of cut you off there. Do you have any more suggestions about how to find a practitioner that will work with dancers well?
Yeah. So I think the only other thing is I would maybe take a look at the types of techniques that they've been trained in. Mm-hmm. There's some that are, you know, that can just give you a little bit of a baseline to know that they've at least been exposed to some of this material, or it doesn't necessarily mean that they practice it all the time. But for example, a couple that I would look out for would be like active release technique, ART. It's a very effective soft tissue technique. Graston, which is a soft tissue one where you're kind of working on the muscles. If they are trained in any type of functional movement assessments or functional training, as well as one that I have trained a lot in is called DNS. So that's dynamic neuromuscular stabilization. That allows you to have kind of a deeper neurological evaluation and progress that into treatment of the person's body as a system and as a whole. So a lot of times, you know, you go in for foot pain and the doctor only looks at your foot. So that's something to be aware of. There, you know, if you're having foot pain, there needs to be a more detailed evaluation of how is the whole system working, not just one of the parts, not just one of the pieces. we want to see how everything's working together, because after all, what's that saying? You're attached from your toe to your head, or the tip of your toe to your head, something.
Mm-hmm.
We're connected, right? So that's what I can think of. Do you have anything that you can think of that I didn't touch on for that?
I think maybe the only thing I would throw in there is like look around the office and see if they have any weights laying around. Do they have any TheraBands and things? Do they have a room where you do exercises? If it's just a treatment room, they probably aren't going to be doing a lot of exercises with you. And maybe you'll find a random one, but that would be my best like educated guess, having gone in some doctor's offices. So
I can tell you at my practice, I start in the room with the patient and we discuss everything and work on some of the passive stuff first, soft tissue adjusting if necessary. And then I spend most of my time, I have an open rehabilitative area. I call it the rehab area, where we have space to do whatever we want. So that's kind of how my clinic flows. Yeah. But I mean, I'm sure there are people that have large treatment rooms where they can do some exercises, but just knowing that you're going to have the active portion where you're moving and you're loading and strengthening, and then you are going to have the passive portion too. And what I mean by that is when the practitioner is doing something soft tissue wise, adjustment wise, that type of thing. There is something else I wanted to touch on though.
Yes.
Is the, excuse me, what do we want everyone in the dance community to know about pain and movement, right? And I think that it's become very normalized to have pain and to dance through pain. And I think it's important to distinguish the difference between like, oh, my muscle's burning because I'm working really hard at this exercise or this movement, versus, oh, this is like bad pain. This is like getting up there in the scale of intensity, and this is not something that you should have to push through. Yeah. I want everyone to know that it's not normal to dance with pain, and the pain is a warning sign and an alarm bell that's going off, and your body's trying to communicate that with you. Yeah. So not to take that lightly, and it should not be the status quo that we're dancing through pain all the time. And I mean, I've done it, you've done it. My mom used to always say to me, Courtney, you're going to regret this when you're older, and if there's anything that you and I can do to help people to prevent long-term, injuries, then let's do it.
Yeah, absolutely.
Consequences is the word I was trying to think of, like long-term consequences of pushing through that pain and dancing.
Yeah, absolutely. And I think that we'll have to talk more about pain in general because, it, like you said, it is a warning sign. It is your body telling you something. So I can say,
listen to that.
Yeah. Some of the most common pains that I had when dancing were my knees, and I would pull my back all the time, like on the ground, pull my back. And I wish that I had taken care of that differently, because that was a repetitive sign coming on. And then last year, I actually had a disc injury for the first time, and I didn't realize how different those pains were. It was a very good learning lesson for me as I work with people, because they were completely different pains. And I was like, oh, this is what it feels like. So right. I can very clearly now tell you the difference between a muscular pull pain or spasming pain versus a disc pain. And I can tell you the difference between I'm working, my quad is fatiguing. I'm doing this exercise type of discomfort. So I know
it's important to distinguish between those types of things. And if you've never had pain and you just started getting it, then maybe you're just not familiar with exactly what's going on. Mm-hmm. And that's something that we can help with too, is really discussing that and diving into that.
Yeah. Yes. So dancers, communicate with your parents and your teachers. Know that pain is not normal. I feel like sometimes dance teachers, they have so many students in their class. They're trying to get things done in an hour. And unfortunately, sometimes your pain is not their top priority when they have 20 other dancers in the studio. So you really do need to use your parents as your advocates, and parents. Mm-hmm. I know that's your job, but that is your job. And if
we need a team of people around us.
Yeah. And
there's no reason to not access some of these resources that are available to all of us.
yes. So parents, parents, if you feel like one of your kids are kids that always complain about pain, start developing a different communication with them so that you can start identifying if it's a serious pain, if it's just a I'm tired pain. I've used a 1 through 10 scale. I always ask them when they say like, oh, it's an 8. I'm like, okay, what was the worst pain you've ever felt in your life? Because they'll be like, oh, when I stubbed my toe. And you're like, okay, that's not an 8. That's not a 10, so it helps you to kind of dial into what their pain scale is. I've used red light, yellow light, green light. Green light are good. Yellow light is like, I'm starting to feel things. It doesn't feel great, but I could still move. And red is like, no, this hurts. I can't move. So there's kind of these different ways that you can start identifying what your kid's pain is. And then honestly, if you're not sure, reach out to someone like Dr. Wilson. She's going to be great in being able to assist you to figure out what actually is an issue and what's not an issue and what's a growing pain and what's just, your kid needs to toughen up or dancers, we need to get
more sleep. You need better nutrition. These are all factors that play into how our bodies feel on a daily basis.
Yeah.
And I mean, if I could even just get some of my patients to sleep like more, those pain intensities would go down for sure.
Yep, definitely. Especially as they're growing.
I mean, I even experienced that as an adult. Like when I do a tough workout, and I only get 7 hours of sleep when I usually like to get 9 hours of sleep after that tough workout. If I get the 9 hours, I'm not as sore the next day.
Yeah, absolutely. Yeah. That's totally true. Well, we're coming up on our time here. So Dr. Wilson, tell us how we can get in touch with you. I didn't mention where you're located. So if you are in the Southern California area, I definitely recommend you go find Dr. Wilson. So tell us where you're located and how we can get in contact with you.
Yeah. So my practice is called Empower Health and Performance, and we're located in Cypress, which is in Southern California. We're just going through a whole rebrand and everything. So we're going to be getting going here on Instagram and everything. And our Instagram name is Empower HP. So it's Empower with an E. So EMPOWER HP. That's where you can find me on Instagram. And if you have a direct question or you want to learn more or you want help finding a practitioner in your area, send me an email. My email is drcourtney@empower-hp.com. So that's DRCOURTNEY @empower-hp.com. So I'm more than happy to answer questions if it's a dancer, if it's a parent. I want the best for everyone in the dance community and not to experience the things that you and I experienced, Allie, and just have a voice of reason and someone to reach to and to ask questions. Because part of the problem is you don't always know what you don't know, right?
Yeah.
You think doing a good thing and it might not be actually the best thing for you. So just to have somebody to be a voice of reason.
Yeah, absolutely. Absolutely. And I'm going to put all of her information in the show notes so you can look for it down below and just click right through. And you also all know that you can use me as a resource also. So we're both of us collectively working to find resources for you guys all over the U.S. and in other countries as they pop up. And we can assist you to find the practitioner that works for you guys, that kind of meets some of that criteria that Dr. Wilson was talking about. And we just want everyone to be healthy and happy emotionally and physically and moving well. So thank you so much for coming on, Dr. Wilson. This has been great. We will definitely have you back because we have a lot to talk about. We had to actually
so much to talk about.
We had to, before the podcast, say, okay, these are the areas we're not going into.
We're going to down that rabbit hole today. It cannot be a 3-hour podcast today.
Yes. So we will be back. We have a lot to say. That's Courtney has great information. So we will have you back and we will dive into some other stuff. So thank you so much for coming on.
Great. Yeah, I look forward to it. Thanks, Allie.
That wraps up our time with Dr. Wilson. Thank you so much for listening to the two of us go back and forth. I imagine that you guys were sitting right here listening to all of our little banters and trying to figure out how to solve some of the dance world problems. And I think that that's fabulous. She has so much information, and we really did have to rein ourselves in before this episode. We honestly said, okay, these are the topics that are off the table today, because we can talk for hours. Our favorite thing to do is to meet at this little coffee shop that's right on the beach near us, and we'll sit with our coffees way past the time they're gone, discussing all this stuff and what we can do for our clients and patients and all that goodies. So let's recap here. There's a lot going on this week. Make sure that you check out my Instagram, Align Fitness by Allie, to see what's going on with Dr. Wilson and I. I love what we have created, and this, again, is just kind of the beginning of some of the information that we want to be giving to you guys collectively. So make sure that you're checking out my Instagram for the rest of the week. Her videos will be on there. Second, make sure that you enter for our giveaway. You either are going to end up with a giveaway that you could give us a gift with our online courses or something for yourself. And you also have a chance to win a $50 Visa gift card. And who doesn't want that opportunity? I do. Super easy. Share our podcast on Instagram and write us a review on iTunes. And lastly, I want to share what I'm loving. This week, it is a pleasant surprise to find out that I love Daily Harvest. By the way, this is not sponsored. This is just me sharing the things I love. So Daily Harvest is a smoothie delivery that they come all chopped up and ready in a little container for you, and you just add your own milk of choice and then blend it, and it's ready to go. I was hesitant because in the past, when I've gotten food delivery services or whatever they are, they haven't been the best quality. They're not organic. And I kind of feel like, well, I could make this myself. And I don't have time, nor do I want to spend money to get food that I could make myself. So pleasantly surprised. Everything's organic, everything's prepared, and it comes in just the perfect serving size to add in a snack. They have things that are more green for those of you that want to get lots of extra greens and things. We have ones that are more fruit-based for those of you that may be just diving into the smoothie world. They have ones that have superfoods and ones that have that are a little bit more hearty and ones that are a little bit less, that are just more like a snack. So I've been so pleasantly surprised and loving them, and I just ordered my second bunch. And I am sharing because, parents, I thought this would be the perfect thing for you to throw in the blender as you're walking out the door to pick your kids up from school, do that quick in-between school and dance snack that I know you all have to do. And you're going to know that it's something yummy and full of nutrients, and it's a pretty balanced little package right there. So anyways, see, this is another thing I'm sharing. I will link a little link on this one that if you want to try them, you can get $25 off of your order. I don't get any money from it. It's just me sharing the goodness. So if you want to give it a try, you can do your first order, and there's no commitment. You can cancel it at any time. So as you're going into the holidays and the crazy dance rehearsals, give this a try. Make this a substitute maybe for some of your snacks that are maybe not as high in nutrients. Maybe this is something you can add in, and that is going to assist you to reach your goals. So thank you guys for listening. This was quite a packed full episode. Make sure you get your code for your smoothies. Make sure you check out my Instagram for your videos, and make sure you write your review to win, enter a chance to win a $50 Visa gift card or your online courses. Oh my goodness. Okay, guys, I will see you next week. Thank you so much for joining me today on Beyond the Point.